Now, in 2016, it is crazy to see where medical advancements have taken us.
There is one that doctors are using now that you will not believe. Take a look.
Well, this year marks the 200th birthday of the stethoscope. Scripps Mercy Hospital in San Diego is marking the anniversary by pioneering an ultrasound stethoscope known as the pocket ultrasound. This technology is revolutionizing the way medicine is practiced at the bedside. Here with us this morning to tell us more is Dr. Paul Hahn. Doctor, thank you so much for being here this morning.
Thank you for having me, Heather.
Well, this is really exciting, a pocket ultrasound device. So tell us, how is this different from the regular stethoscope?
Well, a pocket ultrasound machine is, as you see here, a very small ultrasound machine that's small enough to fit in one of my white coat pockets. Now, over the years, you may have seen your doctors tell you, you may have heard your doctors tell you, let's see what's going on inside. Truthfully, we've been lying to you a little bit when we said that, because with our stethoscopes, we can really only hear what's going on inside your body. But with these machines now, we can actually see at the bedside what's actually going on inside your heart and lungs and different parts of the body.
That is amazing. It's so cool to see how technology has kind of evolved throughout the last years. Now, how long has this device been around?
Well, ultrasound has been around for a long time, and it's been in wide use throughout medicine. What's so neat about the recent technological development is that these machines are getting smaller and smaller. What that means is that people like me can carry them around at all times, just like I do with my stethoscope. And it allows us to make it a part of our daily routine physical examination.
So is this something we can expect to see all physicians using in hospitals moving forward?
Well, certainly there is a movement in that direction. Although our internal medicine residency program at Scripps Mercy Hospital is very unique in that we've made ultrasound training an important part of our training of our physicians. It is not yet in wide use. However, more and more medical schools are now also incorporating ultrasound examination as part of their education as well. So over time, it will happen, and we are proud to say here at San Diego that we are at the forefront of that movement.
How exciting, and we can't wait to see, this device being used even more throughout the country. So I know you said that this device is different because you can actually have a visual of what's going on inside instead of just hearing it. But are there any other reasons why this ultrasound pocket device is better than a stethoscope?
Well, we recently did a study here at Scripps Mercy, a study involving our residents. They were asked to examine several patients, some with disease, some without, using their traditional physical examination skills. And then they were asked to re-examine the patient using these devices. And it turns out our residents, even only after a 1 hour of training, is able to detect abnormalities at a much greater, with much greater accuracy. When you go see your doctor with a vague complaint about, let's say, shortness of breath or palpitations, we can now say with reasonable confidence at the bedside, there really is nothing wrong with you. On the other hand, you may be just seeing a doctor for a routine physical exam without any complaints whatsoever, and we may after a routine examination, we may say, there is some serious abnormalities here. We can now institute preventive measures before a really serious disease hits.
So this is really going to help doctors catch things much earlier than typical. So I think this is great, Doctor. Is there anything else you want to leave our viewers with this morning?
As a nonprofit hospital, we really rely on generosity of the public to be able to fund a lot of these projects and efforts. We are a residency program of about 30 residents, but we only have access to about 10 devices currently, which means only a limited number of residents are walking around today at the hospital with access to these machines. we are in the middle of a campaign to raise additional $200,000 to be able to purchase 25 of more of these devices. And if the public is interested in supporting that effort, they can call 1-800-SCRIPPS or also go to www.scripps.org/support clue, and they'll find a lot more information there.
Great. Doctor, thank you so much for taking the time to speak with us this morning.
And thank you for having me.
Now stay with us. The Morning Blend will be right back.